And the Vatican Children's Hospital drafts a new charter to protect the rights of children with incurable diseases. The move comes 1 month after the death of terminally ill toddler Alfie Evans. He was at the center of a legal battle over his medical treatment in Britain. Pope Francis met Alfie's father just weeks before his parents lost their fight to keep him on life support. They wanted him to be admitted to a Vatican hospital. Alfie was even granted Italian citizenship. Vatican correspondent Juliet Linley joins us from Rome. Juliet, what does this charter say?
Lauren, it consists of 10 articles, and essentially it says that children with incurable diseases have the right to a second opinion and to better diagnostics, as well as compassionate care when they're dying, palliative care. And it also says that they have the right to better experimental treatments and to be moved across international borders. The document was presented at a Vatican conference this week, at which the head of the Pontifical Academy for Life, Archbishop Vincenzo Paglia, talked about how absurd it is for a judge's sentence to overcome the relationship between parent and child. Clearly, he was referring to Alfie Evans' case.
Is this just a recommendation or is it legally binding?
It's purely symbolic, Lauren. Make no mistake, this is the Vatican's pediatric hospital certifying its holistic approach to the human being that every Catholic-inspired hospital adheres to, essentially. It's putting into writing the long-standing principles regarding terminally ill children that Catholic hospitals put into practice. So those principles include putting human dignity of every patient first and safeguarding the rights of parents to make informed decisions for their own children.
Our White House correspondent yesterday reported that President Trump signed the Right to Try law, which helps terminally ill patients seek experimental medication. This is what the families of Alfie Evans and Charlie Gard wanted to do in the UK, but they weren't allowed to. So how would this charter, even if it's just a recommendation, avoid cases like that in the UK?
Lauren, that remains to be seen. Certainly here in Italy, when those toddlers' cases came to the fore, there was a sense that, in a way, we are fortunate to have bioethical commissions here, which patients' families can turn to in delicate medical circumstances, whereas in the UK, it's a judge that rules. The novelty here is that the document refers specifically to kids with incurable illnesses, and it includes the right to care when a patient is dying, and also to spiritual, psychological support for the family, and saying that children have the right to be moved to other countries, which was an option that was not available and that was not granted by the British judicial system to Alfie and to Charlie Gard. Charlie Gard was another terminally ill British toddler who was caught in a legal battle last year over his treatment, and he wasn't allowed to go abroad, and he died at the age of 11 months. So, Lauren, unless the British hospitals follow Bambino Gesù, the pediatric hospital here at the Vatican's guidelines or their charter, this is not going to necessarily change anything with cases such as Alfie's in the UK.
It would have to come from a judge in the UK. They'd have to change their court system. All right. Thank you for clarifying. Juliet Linley, EWTN News Nightly Vatican correspondent.
Lauren, thank you.